Hi, I'm Genevieve Dicing with H&HN, and I'm here with Maryjane Wurth, Executive Vice President of the American Hospital Association and President and CEO of the AHA's Health Forum. The annual Rural Healthcare Leadership Conference is coming up on February 5th through 8th, and Maryjane is here to tell us about it. Maryjane, thank you for being here. Why is it important for hospital executives to attend the Rural Leadership Conference?
Well, thanks, Genevieve, and I appreciate you asking me to give some comments on the Rural Healthcare Leadership Conference this year. As you know, it is the 30th anniversary of this must-attend event, and we have already over 700 leaders from throughout the country planning to attend. So we are very excited about this program. And given that on January 20th we have the inauguration of the 45th President of the United States, Donald Trump, occurring, and a new administration coming to D.C., the timing of this conference really is great for attendees to hear about what's on the federal agenda ahead, including some challenges that we have that are related to efforts related to the Affordable Care Act, repeal and replace, and also initiatives that may emerge around Medicaid restructuring. And then, of course, as you know, is very important to this audience, a range of very specific federal issues related to rural providers that we want to make sure that all of the audience understands and invite them to be joining with us on our strategy to make sure that rural providers are appropriately advocated for and represented to Congress with the importance of what they do. In addition to all of that, we have a number of other very exciting programs. We just completed work by a committee on access to vulnerable communities that we're very excited about. And there will be 2 sessions that really focus not only on the work, but the recommendations of the task force related to new models and strategies for rural providers to take. So I really urge attendance at that session. You know, in addition, we have MACRA, which is a new physician payment system, and the implications for rural providers. And we have other programs related to technology innovations, digital innovations and strategies, and also some new initiatives that AHA has related to hospitals working on violence issues in their communities. So I think given all of that, I certainly am excited about the participants coming and certainly think there will be much for the leaders and the trustees who are attending to gain from this program.
Great, thank you. With that in mind, what speakers would you like to highlight?
Well, you know, it's hard to single out any particular one. There is really a robust panel of speakers that, again, are talking about not only the federal issues, but on governance issues, technology issues, and strategies for our members to really pursue. But I have to admit, there is one that I am particularly interested in attending, and that's Jake Wood's keynote session, that I think sum up the times perfectly, really talking about leadership, peak performance, and really managing in a time of profound change. And if, again, that doesn't sum up where we're at, so I think it's going to be a great session, and I'll be there, and I certainly hope that I get to see many of the participants at that session.
With such a rich lineup, what are some key takeaways that attendees can get from the conference?
One of the things that I think is really critically important right now is that rural hospitals and health systems are the anchor of their communities, and they offer an essential community service in a very vulnerable time. Not only do they provide the full array of acute and specialized services, but they have a robust array of services related to well-being and health that are just so critically important. So not only do I hope that they have a time for new insights and thought leadership and networking with peers, but they walk away with some concrete strategies that they can assess and apply related to their planning around new models, new payment implications, technology, patient management practices, And as importantly, really understand the resources and the messaging about how to tell the story of the rural provider who are working day in and day out, 24/7, week after week, to really meet the needs of their patients and communities, and that they have access to quality, safe, and coordinated care. So I think there's much for everyone to gain.
Thanks for being with us. I'm Genevieve Dicing for H&HN.